test item cluster for mechanical neck pain that benefits from thoracic manipulation includes 6 criteria. I've already asked Courtney to fill out the physical assessment portion of the FABQ. The resulting score will be used later on. Then, you must ask your patient 2 important questions. Courtney, how long have you had your symptoms?
I'd say about 2 weeks, probably.
2 weeks? Okay. And do you have any symptoms below the shoulder?
No, I don't.
Okay. Next, we'll assess thoracic spine curvature. So you want to make sure that you're feeling down the spine and using your knowledge of normal thoracic curvature. Once the thoracic spine is assessed, cervical extension range of motion is measured. Courtney, can you go ahead and look up towards the ceiling? So next we'll perform the TIC for full thickness rotator cuff and subacromial impingement. The first test we'll do is the drop arm test. This is a rotator cuff tear test. So you'll have your patient abduct to 90 degrees and just simply ask them to control the movement down. Good. Next test, go ahead and sit down. We'll do the painful arc sign. So all I want you to do is raise your arm up all the way to your head as high as you can. Without pain. Do you have any pain?
No pain.
Okay. The next test we have is the infraspinatus test. So I want you to keep your arm here. Don't let me push you in.
Okay.
Good. Next we'll do the Hawkins-Kennedy impingement test. So I want you to go ahead and bring your arm out here across your chest. I'm going to add some rotation. Tell me if there's pain. Okay.
No pain.
Test item cluster for mechanical neck pain that benefits from cervical manipulation includes 4 different components. Courtney and I have already established that we both expect the manipulation will benefit her cervical neck pain. Now I'm going to assess her cervical range of motion, both sides, and assessing the difference. Courtney, go ahead and rotate your head towards the left as far as you can. Back to center. Good. And then I'm going to ask that you rotate your head to the right as far as you can. Next, perform PA testing. And you're looking for pain in the area as well as any stiffness, indicating a hypomobile segment or excessive motion hypermobile segment. The test item cluster for cervical radiculopathy includes 4 different tests. First, I'm going to assess Courtney's range of motion, specifically rotation. You can do this globally or with the goniometer, depending on how experienced you are. Courtney, can you go ahead and rotate to the left? Good, as far as you can, and back to center. Next, I'll perform the Sperling A test. Sperling A test requires the patient to side bend towards the painful side, and then you're going to add a little bit of overpressure to see if you reproduce symptoms. Do you have symptoms?
Yeah, it hurts.
And relax. The third test we'll perform is called the distraction test. Your patient is laying supine and you're simply going to distract the cervical spine and ask your patient if they have any change in symptoms. Courtney, how does this feel?
It actually feels pretty good.
Okay, now relax. The last test we'll perform is the upper limb tension test A. This stresses the median nerve. So I will have Courtney abduct your arm as I press the scapula. I'm going to extend her fingers and wrist, and then lastly extend the elbow. Side bend your head towards your right side, and then towards your left side. Ooh. And relax. The last test I'll perform is the upper limb tension test for the radial nerve. So have your patient lying in supine, stabilizing and depressing the scapula. Ask your patient to abduct and internally rotate the arm. Keep that elbow flexed first. First, flex the wrist and the hand, and then you're going to slowly extend the elbow, seeing how far you can go with that extension. And repeat on the other side to compare. Okay. This is the differential diagnosis for rotator cuff tear versus impingement and C5 or C6 radiculopathy. Keeping in mind the C5 dermatome is in this area here. C6 is known as that sharpshooter, and also assessing the myotomes. So for C5, I'm going to have you raise your arms out to the side. Can you do that for me? Good, and back down. C6, elbow flexion, wrist extension. So I want you to do this move here. For the infraspinatus test, tell the patient to resist your force to measure the strength. The drop arm test is next. Again, inability to control the movement suggests supraspinatus tendon tear. To assess for impingement, perform the Hawkins-Kennedy test. Ask if pain is present. With the painful arc sign, pain will be evident when the patient attempts full abduction of the shoulder. So next we'll perform the Sperling A test. I'm going to have the patient side bend towards the painful side, and I'm going to add some compression. The distraction test helps to assess for cervical radiculopathy. The sulcus sign test measures shoulder stability. It must be compared to the other side to determine if instability is present. The next test is the subscapularis test, also called the Gerber's test. Courtney, I'm going to have you place your arm behind your back with the knuckle side of your hand against your back, and then I want you to just lift your hand off and try to touch mine right behind you. Courtney was able to perform the test, but if a patient is unable to perform the test, it indicates that the subscapularis muscle is weak or possibly has a torn tendon. The next test we'll perform is called the Phalen's test. I'm going to first demonstrate the motion. Courtney, can you go ahead and flex your wrists, pushing against each other, the back of the hand? Good. And I'm going to add a little bit of pressure, and we're going to hold this position for 1 minute. A positive sign is tingling in the distribution of the median nerves. The next test I'll perform is the Finkelstein test. So I'm going to ask that the patient go ahead and place their arm like this. I'll stabilize the forearm. Go ahead and make a fist with your thumb in the center. Good. And I'm going to ulnarly deviate, looking for any signs of pain. Do you have pain?
Yeah, there's a little pain there.
And that's a wrap.